So far, we've talked about consumer engagement and education. We've talked about technology lowering costs and even ideas around the evolution of digital health. For the last question in the last few minutes, I'd like for each of you to talk about how your products and implementing them to the health sector today, what does that look like for each of you?
Well, with our first company that we spun out, Corventus, in the area of heart failure, it's the number one reason you're going to the hospital over 65. It's the number one expenditure by Medicare. If you realize the intervention is if you make it early enough, the intervention is a 20-cent diuretic pill to take the excess fluid out versus a $6,000 hospitalization. It makes pretty good economic sense there. In terms of obesity, this patch tells you, can you apply it in a clinical setting or in a consumer setting? Yes. But the question is where are you going to make the most impact on that caloric-related issues? And I think there's a good debate there whether or not it's better to go after the mass public to teach them of how many calories. Because by a show of hands, does anyone in this room today know how many calories you've eaten today? 1, 2? I had a hesitant hand. All right, so that's the point but the easiest way to lose weight is what? Calorie restriction, not exercise. So wouldn't it be interesting to know how many calories you've eaten so you could better balance that? So the idea here is to enable you to not have to worry about a patient diary, but to use this in a way that gives you the power to manage yourself instead of looking to somebody else to tell you what to do.
We're actually in the same boat. We also want to help empower patients to manage themselves more effectively. If patients are able to manage themselves more effectively and know what to do and have trustworthy sources and have prompts that help them do the right thing in the right moments, that's going to take a lot of tension out of the system because you won't have doctors basically struggling to push patients in the right direction who aren't really prepared or educated to understand what the doctor's telling them. I mean, also our system can help doctors really diagnose and help patients who only, as a patient, you see a doctor for 2 minutes every 6 months or 3 months or 12 months. And the doctor really has no clue what's happening in between those patient visits. But with Proteus' system, the doctor actually can know, if the patient is taking their drugs correctly, if the patient is getting enough exercise, if the patient is sleeping correctly, and all of those things, the doctor has a longitudinal picture, and so can actually make a diagnosis and help a patient based on reality rather than what that doctor is able to gather in 2 minutes.
Excuse me. I think for us, the emergence of standards like the IEC 80001, which is this standard around how do you set up IT medical networks and how do you make them robust and how do you manage them, I think that's going to serve a big role in the next couple of years because in hospitals, in senior living communities, and homes, as we become very dependent on being able to move our information around, we have to make sure that we set these networks up so that the people that are becoming very reliant on them have the availability and the robustness of the systems in order to deliver this. And from our experience, even in hospitals, there are not today standards that help give the engineers and the people implementing these systems guidance on what are the best practices that are out there today. And I think that as you carry that further through the care continuum all the way out to the home, that's even less defined. So, as someone becomes very dependent on the kinds of technologies that we're delivering here, figuring out how to make sure that that always available connection is there for them if they're relying on that prompt for medication information or fall management or changes in their activities of daily living.
I think a lot of the benefits we maybe touched on already, but some of the things that we've been trying to work for the patient is to try and get prosthetic devices that is more cosmetic to start with, to try and give something that patient feels comfortable wearing, both in public and also for their own functional. We can get a lot more function out of a compliant hand. At the moment, we're working very hard to try and get everything as good as possible in terms of speed and grip, as well as various different programs for complex grips. But also, as much as we can produce something that looks fairly realistic and to cover it, to make durability, give the patient almost skin matching as well as realistic fingers, the first thing that we get is take it to the patient and they come back and they say, can you make it look silver? Can you make it look more robotic than it had before? So, you know, thanks for all the hard work we've done there. But yeah.
Well, Harry Potter.
Yeah, it's, you know, whichever way of the argument it is, it's as you know, completely realistic or back to sort of cyborg kind of stuff. So it's interesting years to come, I think.
Well, thank you all very much for your time and sharing your ideas around digital health and game-changing technology. I will say that I don't know how many calories I've consumed, but with Darrel, feel free to stop by the Microsoft booth and engage in Xbox Connect. You're guaranteed to burn some calories. Thank you.